A vaccine for COVID-19 could get federal approval in just 2 days, and local health systems are preparing right now to get the first doses of that vaccine out to the public. Jack Watson joining us live from URMC with more on this. Jack.
That's right, Adam. As that vaccine is rolled out in the United Kingdom, we could see something very similar soon here in the United States, in New York State, and locally here in the Rochester area, as both major health systems in the area inform and prepare tonight.
Of the vaccine.
In a discussion over Zoom tonight, Rochester Regional Health joins Central Church of Christ in Rochester, attempting to get info out about that COVID vaccine. Dr. Nana Duffy with Rochester Regional says the research shows the vaccine works.
The vaccine is not only safe, it's remarkably effective.
Dr. Duffy adds few report any issues, but the few who do.
Maybe a headache, maybe fatigue, maybe feeling run down for a brief period of time.
Across town, the University of Rochester Medical Center showing how it's storing the vaccine before it gets handed out. This video, courtesy of URMC, who says it gets here in dry ice and has to be stored in special freezers.
So the recommendation is that when we receive it, we get it into the freezer right away, or we have to recharge the dry ice in the box within 24 hours.
Chief Pharmacy Officer Kurt Haas explains there's a lot that goes into preserving the vaccine.
They asked us to transfer it between the shipping carton and our freezer in less than 2 minutes, so they don't want it exposed to any ambient temperature for any length of time. Once we remove the vials from this freezer, they're good for 5 days at refrigeration temperature.
Clearly plenty that goes into the process. Rochester Regional's Dr. Duffy says getting vaccinated means we all get a return to normalcy and we save lives.
We're asking you to get the vaccine so that your neighbor's children can go back to school, so that your friend's mother can come to her wedding, so that we don't.
So, Adam, should the vaccine get approved and when it gets widely distributed throughout the U.S., Dr. Anthony Fauci, and this was mentioned in the Rochester Regional presentation today, Dr. Anthony Fauci says that roughly 80 to 85% of the population would have to get the vaccine in order to bring infection numbers down. Live in Rochester, Jack Watson, News 8.
All right, Jack, thank you. What a project. And tonight, the White House Coronavirus Task Force warned about what the vaccine will not do. And this speaks to what Jack was just talking about. It will not by itself reduce the speed of the virus's spread, hospitalizations, or deaths until 100 million Americans with underlying conditions are fully vaccinated. That's not expected to happen until late spring. So again, all of those precautions are still advised going forward.